This video only covers selected highlights of the Remunity Pump user guide and is not intended to replace the user guide. For complete details, including warnings and cautions related to the Remunity Pump, refer to the user guide. For safety information related to Remodulin, please see the end of the video and the full prescribing information. This video will guide you through the important steps involved in filling a Remunity Pump cassette with Remodulin on your own. If you are receiving pre-filled cassettes from your specialty pharmacy, you may never have to fill a cassette on your own. However, emergency situations can still arise. If they do, it's essential that you know how to fill a cassette. Let's get started. Self-filling involves taking an empty cassette and using a syringe to fill it with Remodulin. First, gather the supplies you will need. These include a sharps container, a vial of Remodulin, a 3 ml syringe, alcohol pads, and an empty cassette. To begin, you will first need to stop delivery of Remodulin to change your cassette. To do this, 1. Start by pressing the side button to wake up the remote. 2. Unlock the screen by pressing each of the front buttons one time, from left to right. 3. Highlight Change Cassette and press the checkmark button to confirm stopping of delivery. Next, you will need to disconnect your current infusion tubing from your body. It is important to remember not to remove the pump from the used cassette until after you have removed the infusion set from your body to avoid unintended medication delivery. Once your infusion tubing has been disconnected, rotate the pump counterclockwise until it separates from the used cassette. Dispose of both the used cassette and infusion tubing, and you are now ready to self-fill your cassette. Remove the empty cassette from its packaging and place the black side down on a flat, non-slippery surface. Firmly press straight down on the top of the cassette with the palm of your hand until you hear a click. Inspect the cassette to ensure it is fully clicked all the way around. Then, take your needle and syringe and twist the needle onto the syringe until it's tight. Next, clean the top of the Remodulin vial with an alcohol wipe. Then set the vial down. If you are unsure of the prescribed amount of Remodulin to draw up, contact your specialty pharmacy. Carefully remove the cap from the needle. Prepare the empty syringe by pulling back the plunger and filling it with air. You should pull it back to the prescribed amount of Remodulin as instructed by your specialty pharmacy. Then, insert the needle into the vial. Push down on the plunger of the air-filled syringe. This pressurizes the vial. Next, turn the vial upside down with the syringe in it. Slowly pull down on the plunger to fill the syringe with the prescribed amount of Remodulin. With the needle facing up, gently tap the syringe to remove any air bubbles. Then, withdraw the syringe from the Remodulin vial. As you're working with the syringe, try holding it like a dart. Locate the small hole in the filling aid. Keeping your hand clear of the plunger, insert the syringe straight into the small hole in the filling aid. Press until you feel the needle go through the cassette's rubber membrane. Using your thumb, push down slowly on the syringe plunger to fill the cassette with Remodulin. Keeping pressure with your thumb, slowly remove the syringe once it's empty and dispose of it in a sharps container. If damp, wipe any moisture from the cassette. Then, continue as you normally would. Connect the new infusion tubing to the cassette by twisting together. Place the end of the infusion tubing on a folded paper towel. Holding the black side of the cassette firmly, rotate the white top clockwise until you hear a click and the tubing lines up with the droplet symbol. As soon as the medication starts to appear at the end of the tubing, immediately rotate the filling aid back to the left or counterclockwise until the tab on the filling aid aligns with the unlock symbol on the cassette. Your tubing has now been primed. Detach the white filling aid from the cassette and discard. Align the pump bump with the unlock symbol on the cassette. Push down and rotate clockwise until it is aligned with the infusion tubing and lock symbol. The pump will emit a series of beeps as it performs the self-test. It's important to wait until the self-test is complete to continue. Next, connect the infusion tubing to the catheter. Press the checkmark button on your remote to start delivery of Remodulin. Confirm that the remote displays a green status bar indicating that the pump is delivering medication. Verify the rate and adjust if necessary. Discuss any other questions you may have with your specialty pharmacy or call customer service. Remunity Pump for Remodulin treprostinil injection. Indication: the Remunity Pump for Remodulin treprostinil injection is intended for continuous subcutaneous delivery of Remodulin treprostinil injection for use in adults greater than 22 years of age. Important safety information for Remunity. Warnings and cautions. Do not use the system outside the conditions listed in the user guide. Retain the user guide for future reference. Refer to the user guide for all warnings and cautions. Failure to comply with the following warnings and cautions may result in harm. Limited to use with Remodulin. Only Remunity cassettes may be used with the Remunity Pump. Remunity Pump is for use only with FDA-cleared infusion sets. Medtronic QuickSet Infusion Set, MMT-392, MMT-393, Medtronic Silhouette Infusion Set, MMT-373, and Smith's Medical Clio 90 Infusion Set, 21-7230-24, 21-7220-24. Do not use disposables from previously opened or damaged sterile packaging, damaged disposable components, or expired sterile components. Discontinue use of the remote and switch to the spare remote in the event the remote fails to operate. The use of cables, batteries, and battery chargers other than those provided or specified may result in increased emission or decreased immunity of the Remunity Pump infusion system. Do not disconnect the pump from the cassette while the cassette is connected to the catheter. Avoid exposure of your pump and cassette to temperatures below 41 degrees Fahrenheit, 5 degrees Celsius, or above 104 degrees Fahrenheit, 40 degrees Celsius. The pump may affect nearby electrical and electronic devices, including medical devices, cell phones, Bluetooth devices, RFID readers, Wi-Fi equipment, and strong magnetic fields, causing these devices to operate abnormally or to stop functioning. Do not open, crush, heat above 140 degrees Fahrenheit, 60 degrees Celsius, or incinerate the pump battery or remote, as doing so can lead to fire or rapid spreading of fire resulting in harm. This system supports flow rates between 16 microliters per hour and 225 microliters per hour. If your flow rate is outside this range, discuss with your healthcare practitioner. Prescription information. Caution: federal law, USA, restricts this device to sale by or on the order of a licensed healthcare practitioner. Use of this device without the training and supervision of a healthcare practitioner may lead to errors that result in harm. See the Remunity Pump for Remodulin treprostinil injection pharmacy-filled user guide for further detailed important safety information including warnings, cautions, and instructions on how to properly use the system. For further information, please call United Therapeutics Corps at 1-877-864-8437. The Remunity Pump for Remodulin treprostinil injection is manufactured for United Therapeutics Corps. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. Remodulin treprostinil injection. Indication, or what is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver or kidney problems. Your Remodulin dose may need to be adjusted if you have liver problems. Have low blood pressure or bleeding problems. Are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure. Symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilatation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-877-UNITHER, 1-877-864-8437.